Hello everyone, this is a video on clinical demonstrations on complete denture, part 4, recording of MMR. These are the materials and also the instruments that you need to prepare during the visit. The aims for MMR visit: number 1, to create and outline the form of the upper wax rim. Number 2 is to achieve reproducible relationship of the mandible to the maxilla at an appropriate vertical and horizontal dimensions for the patients. Number 3 is to record and transfer the patient's maxillomandibular relationship to an articulator. And lastly, to select the teeth for the complete denture. These are the maxillary and mandibular rims that you receive from the lab. Check the rims if they are well adapted to the master cast. In this case, we have made heat-cured base plates which are clear in color, rigid, and it will become part of the final dentures later. Before putting the base plate inside the patient's mouth, you have to check if there's any sharp edges or acrylic pearls on the impression surface. Trim the sharp edges accordingly. Make sure the edges are rounded and smooth. Repeat the same steps for the mandibular base plate. Insert the maxillary rim. Check for the stability and retention of the maxillary base plate. Repeat the same steps for the mandibular rim. Then, check the gross extensions of both the base plates. Gently manipulate the cheek while checking the base plate's extension. Repeat the same steps for the mandibular base plate. Mark the overextended flange with an indelible pencil to shape the flange and the lingual pouch of the mandible base plate. Make sure the posterior extension is until 2/3 of the retromolar pad. Now let's look at how to create and outline the form of the maxillary denture. Ask the patient if he's happy with the appearance of the upper lips and if there's anything that he would like to improve in the new dentures. Compare the labial support of the maxillary rim with the patient's existing denture. To determine the upper lip support, as a general guide, the nasolabial angle should be about 90 degrees. Therefore, we should use this guide to provide adequate upper lip support for the patient. In this case, we need to add wax on the labial surface to give more lip support. To do that, you cut the modeling wax and warm the wax properly. Reinsert the patient's existing denture and compile it with the maxillary rim again. The labial surface of the rim should be able to reshape the philtrum of the upper lip in order to provide a nasolabial angle about 90 degrees with the columella of the nose. When you have done with the adjustment, ask the patient to look into the mirror and check if he is comfortable with the upper lip support. Now we look at the positions of the incisal point relative to the patient's resting lips. In general, upper central incisors edges are between 0 to 4 mm below the resting lips, and it also according to the patient's preference as well. Observe the level of incisal plane when the patient is at rest. We can see that the incisal plane is about 2 mm below the resting lips. Make sure you check the buccal corridor as well. And now we can observe the labial edges of the anterior occlusal rim gently in contact with the wet, dry line of the lower lip. After you are happy with the outline form of maxillary rim, we look at the orientations of the occlusal plane. The horizontal plane or the incisive plane should be parallel to the interpupillary line or at right angle to the long axis of the patient's face. The sagittal plane or the posterior occlusal plane should be parallel to the ala tragus line. Now we want to determine the maxillary anterior plane. Use the Fox occlusal plane to check the plane as shown in the video. The clinician should be positioned in front of the patient with the patient's head in an upright position. Check if the maxillary incisal plane is parallel to the interpupillary line. And now we can see that the plane is not parallel to the interpupillary line, where the plane is higher on the patient's left-hand side. So we have to adjust the level of the occlusal plane. We warm the modeling wax and add the wax on the left occlusal surface. Warm up your wax knife adequately and smoothen the wax. After that, warm up the scraper and level the wax until it is smooth. Reinsert the maxillary wax rim and take the Fox occlusal plane to check the incisive plane and the posterior occlusal plane as shown. Now you are done with the outline form of maxillary wax rim. We can proceed with establishing vertical dimension of occlusion. These are the definitions of occlusal vertical dimension, OVD, resting vertical dimension, RVD, and freeway space. Willis bite gauge is used to measure the OVD and RVD. Please note how it is put together. It may not appear like this straight from the sterile pack. Insert the mandibular rim to check if it gives appropriate lower lip and buccal mucosa support. We first measure the RVD. With only the mandibular rim in situ, now we have to identify patient's RVD. Alternatively, you can choose to insert only the maxillary rim. There are several methods to determine the RVD. The most common way are to ask patients to relax, gently and lightly close lips until nearly touch. Repeat the measurement several times to see if the measurement is consistent. A desired freeway space is usually 2 to 4 mm. A tentative OVD is obtained by subtracting the freeway space from the RVD. Once you have got your tentative OVD, place a maxillary base plate in the patient's mouth. The thumb and the first finger of the right hand are used to stabilize the mandibular rim. Patient is asked to close his jaw while the tongue is curled back and touching the roof of the mouth. This is to keep the mandible maximally retruded. Check if the wax rim has even contact on both sides. In this case, the rims have even contact. If not, you have to trim and adjust the mandibular rim. Then check the OVD while both base plates and the rim are in the mouth. Here the OVD is more than the tentative OVD. Therefore, we need to trim the mandibular rim to achieve the desired tentative OVD. Mark on the mandibular rim the estimated height that you would like to reduce. Heat up the scraper and reduce the wax until the line. Then use a wax knife to trim the occlusal surface until it is even and smooth. Mandibular occlusal plane should be about the level of the lower lip or at the 2/3 height of the retromolar pad. Place both rims in situ and check again for even contacts. Please note that the positions of the dentist's hand is an important factor in making accurate centric relation records and maintaining record bases in their correct position. And now you check the OVD again to make sure the tentative OVD is achieved. There are other clinical tests to reassess of the correct OVD. You can observe the overall facial support, especially the activity of the mentalis muscle. Visual observations of the space between the upper and lower rims when the jaws are at rest. And you can also see if there's presence of a closer speaking space when the S sound is enunciated accurately and repeatedly. When you're happy with your OVD, then you can register your bite registrations. Before you do that, we have to mark the wax rim. Number 1 is a midline. Number 2 is a canine point. Number 3 is high smile line. You can place a floss across the midline of the face, then use a probe to mark midline on the maxillary and mandibular rims. For the canine line, use dental floss to extend from the inner canthus of the eye via the lateral border of the alar cartilage onto the incisal edge of the maxillary rims. With the patient smiling wide, mark the high smile line on the maxillary rim. And now we can register the intermaxillary record. Mark a line on the premolar region on both sides on the wax rim. Cut a small box-shaped slot bilaterally on the mandibular rim near the locating marks. On the maxillary rim, cut V-shaped grooves bilaterally near the locating marks. Make sure the slot and grooves are coincide on both rims. Now we are ready to relate the mandible to maxilla. Practice the following step few times before applying the bite registration material. While your right hand stabilizing the mandibular rim and holding the chin, ask patient gently close the mandible in the retruded jaw relationship. In order to have your patients achieve retrusions of mandible, ask him to curl the tongue back to contact the roof of the mouth. Finally, dispense the silicone bite registration material at the grooves area and ask the patients gently close the mouth while your hand stabilizing the mandible. Wait until material set, then take the rims out from the mouth. Use sharp blade to remove the excess silicone materials. You can easily locate back the occlusal rims with the jaw relationship. Lastly, measure the intercanine distance and select the size and the shade of the anterior teeth. You may use the previous denture as a guide if the patient is happy with his old denture. In summary, these are the clinical sequence in MMR recording visits.